Have you ever wondered why you always get directed by people like me to work with a qualified lactation consultant? Because I'm constantly telling you to tune in to your own intuition and to tune in to your baby. And then I'm also telling you, if you're having difficulty, work with an IBCLC. Well, today I would like to go over what it takes to become an IBCLC and why an internationally board certified lactation consultant is the best person to help you learn how to tune into your baby and help you learn how to tune into your body when you are trying to feed your baby human milk and some sort of struggle or difficulty arises. So, let's get into it. When I began breastfeeding, I was blindsided by how difficult it was. I may have thought I was prepared, but having known only a handful of people who had ever breastfed and only seeing it up close from a couple of them, I had a huge learning curve. Since then, I've become a doula, a lactation consultant, and a childbirth educator. I'm your host, Lo Nigrosh, and I welcome you to the Milk Making Minutes, where we explore breastfeeding experiences through the lens of systemic barriers, so that you know your breastfeeding struggles are not your fault and your triumphs really are the miracles you feel they are. Okay, the first thing that I want to mention is, as you hear me say over and over again when I'm talking to guests on the podcast, is that one of the biggest cultural barriers to being able to feed our babies human milk is that we do not grow up being surrounded by people feeding their babies. If we grew up being surrounded by people feeding their babies and saw it from some of our earliest moments and noticed all the various positions that people did and all the various adjustments they made to both their own bodies and the baby, then we probably would not need as many professionals. But the truth is, human milk feeding was nearly completely lost culturally. And if you want to understand more about this, the best resource that I recommend you read is called The Big Letdown. It's a book. It was written by Kimberly Seals Allers. She's a journalist and a breastfeeding advocate, and she gives a really good history about what happened with breastfeeding. So, a really great read if you're interested in why it has become so difficult to feed our babies from our own bodies. So, why are we always saying, if you are struggling, if you're getting advice that doesn't sit right with you, if you're automatically being told to do timed feeds, or that your baby needs formula right away, which might be the case, but it's always important to protect your milk supply simultaneously, or if you're being dismissed when you have concerns, or you feel like you don't have enough milk, it's so important to work with an IBCLC. This is why. Let me talk to you about the training that IBCLCs like myself, I just received the results yesterday that I passed my exam, which I took a couple of months ago, to be an internationally board certified lactation consultant. I have been working as a CLC for years, certified lactation counselor, and slowly I have been on my way to becoming an IBCLC. And it's taken me a long time because it's a very challenging field to break into, especially if you are not already somebody like a nurse, which I was not. So the pathway I took, there are several different pathways. There's one for if you are already a medical professional. There's a pathway if you would like to get a master's degree in human lactation, which is really inaccessible. There are only a couple of programs in the country. It's very, very expensive, and most people really do not take that pathway. And then there's a pathway for people like me who choose to go the route of becoming a peer counselor. So for me, this was a recognized mother support counselor organization or peer support counselor organization. And I became a CLC first, a certified lactation counselor. And then after I knew, yes, this is what I wanted to do, now I want to become an IBCLC. And I also recognized that peer counselors were really, really important. I joined Breastfeeding USA to become a breastfeeding counselor because I wanted to join an organization that had been very meaningful to me and had supported me in my journey with my first child, who was very, very, very challenging. And I attended in person support meetings when I lived in Connecticut. And so they have a very intense training process to become a peer counselor. It's very evidence based. And then you get to support people always for free, and you get listed in their directories. You can start support groups in your area once you're a breastfeeding counselor with Breastfeeding USA. Other peer support groups that you might have heard of are like Baby Cafe or La Leche League, so places like that. And then once you become a peer counselor, which I still will continue to do with Breastfeeding USA, I'm heavily involved. I volunteer with them at a national level as well. So I will continue to do that. You also need to have 95 hours of lactation specific education. So some of the types of courses that I took were my initial CLC course, which was just a comprehensive course on counseling skills and difficulties that might happen with baby feeding. And then some other courses like sore nipples and sore breasts, how to help with that, nipple pain and nipple trauma, marijuana use during pregnancy, breastfeeding and infant mental health, countering misinformation campaigns and negative messaging in breastfeeding support. Breast milk builds brains. That was the name of another course that I took. Overcoming challenges that physical and mental impairments may present when trying to help somebody, how to navigate lactation support with partners. I took a course called Body Feeding is a Political and Cultural Act, and that was presented by an Indigenous presenter. Um, it goes on and on and on. So many lactation specific courses to make sure that I was fully prepared to be able to meet everyone's needs that I would encounter. And then, of course, I have to recertify every 5 years. So I have to continue to take courses. In addition to the 95 hours of lactation specific training, anyone who becomes an IBCLC must also have 14 health science courses. 8 of them must be college level health and science courses. So those courses include biology, human anatomy, human physiology, infant and child growth and development, research, nutrition, and then either psychology or counseling skills or communication skills at the college level, or some sort of sociology, cultural sensitivity, or cultural anthropology course. And then there are some courses that we have to take, like medical documentation, medical terminology, occupational safety, professional ethics for health professionals, and universal safety precautions and infectious control, which most medical professionals do have to take as well. And then we do have to get our life support. And then, addition to the lactation specific education and the 14 health science courses, those of us who are in the pathway as recognized peer counselors have to have 1,000 clinical hours, documented clinical hours of actual peer counseling to be able to then apply to sit for the board exam. So you apply to sit for the exam. Once you get accepted, the exam is quite challenging. And it's interesting because we have a very specific scope and we have to make sure to stay within our scope. But much of what we are tested on is a little bit outside of our scope. And that is because as IBCLCs, we do also need to be able to recognize problems that fall outside of our scope so that sometimes in the prenatal and postpartum period, when we are working with a family, we often might encounter um, difficulties that are arising within the dyad, so within the feeding parent and or the baby, that we need to be able to recognize those difficulties and be able to communicate when something might be urgent, even if it is outside of our scope, and send that person to another practitioner. And so we get tested on many of those things. And so I thought it might be interesting to talk about some of the things that we get tested on. So the categories that we get tested on are clinical skills, which you would imagine that would be part of it, development and nutrition, pathology, pharmacology and toxicology, physiology and endocrinology, psychology, sociology, and anthropology, and techniques. So, a lot of people think that lactation consultants just help put babies on breasts, but it definitely is not true. We can really help identify lots of challenges that are happening with baby feeding and be your partner to help you determine who might be the right person to go to when there are challenges that are arising while feeding your baby in the early postpartum period. So, for instance, in development and nutrition, some of the topics that come up are feeding behaviors at different ages, term development and growth, breast development and growth, both typical and atypical. So, for instance, breast development begins in utero when the person who has the breasts are in the womb, their breast development begins. And so we need to be able to recognize that because sometimes when milk supply issues arise, we need to be able to have a full history of that breast development if there are some major milk supply issues happening and be able to know what is typical and atypical. We get tested on breast surgeries and the different types of surgeries that exist and what we know in the research, the results are from the types of problems that can arise with milk supply based on the different types of incisions that there are. We actually are shown photographs of various breasts after surgeries, both breast reduction surgeries and implants as well, so that we can, when we're talking to a client, if they have not disclosed that information to us, we need to be able to recognize the scars that we see and to be knowledgeable about those scars so that we can then further that conversation along. We get asked questions about stooling and voiding, skin tone, tone, and reflexes in the baby, food intolerances and allergies, infant anatomy and anatomical or oral challenges, both formal and informal milk banking, preterm development, growth, and behaviors, including late preterm and nipple modifications, just to name a few of those topics that might come up in development and nutrition. And then when it comes to pathology, some of the topics that might come up are milk supply, low and oversupply, nipple pain and trauma, mastitis, maternal disability, physical and neurological disabilities, maternal chronic disease, cleft palate, lip, cleft lip, congenital anomalies that might occur, both gastrointestinal, cardiac anomalies, infant cancers, postpartum hemorrhage, vertically transmitted infections, because we need to be very knowledgeable about those sorts of things when it comes to milk supply and the correct response, even given where you are located in the world, because our certification is an international board certification. When it comes to pharmacology and toxicology, international board certified lactation consultants need to be aware of medications, prescription, and over the counter diagnostic and therapeutic procedures and their impact on lactation, herbs and supplements, tobacco and nicotine, cannabis, galactagogues, drugs of abuse, contraception, chemotherapy, all how they can impact the parent and the baby both prenatally and during the milk making time. And so we get asked a lot of questions about medication on the exam. And then we also need to know those go to resources to be able to point our clients in those directions. And often our clients get told misinformation by their providers. And so, what we often do is provide them the correct information and then have them go discuss the information that we provide them with the providers who have prescribed the medication. In physiology and endocrinology, we discuss diabetes and inducing lactation, relactation, um, tandem breastfeeding, hypoglycemia of the newborn, maternal autoimmune disorders, which can impact milk supply, maternal metabolic and hormonal disorders, which can definitely impact milk supply, infertility issues, and the hormonal influence of milk production. And so we get tested on many topics related to physiology and endocrinology. Um, when it comes to psychology, sociology, and anthropology, we could get tested on maternal mental health, identifying support networks, family lifestyle, employment, and returning to work, foods to eat or avoid that affect lactation, birth practices, breastfeeding dyad relationship, maternal psychological or cognitive issues, safe sleep practices, weaning, transitioning to parenthood. And then, of course, we get tested on techniques. So, effective milk transfer, including medically indicated supplementation, the importance of the first hour after birth, managing supply, expression, both pumping, hand expression, leakage, positions while being hands off, breast and bottle refusal, and kangaroo care. So there are so many different areas that we have to dive into and know, and not only know in our brains, because there's no way that any one person can have all this information memorized, but know the best resources to go to so that when a client reaches out to us on a specific topic that we do not really know ourselves because we've never had to dive into it, we know those resources to be able to find them so that we can educate ourselves and then pass on the correct education to our clients. Because so often people are asking these questions in mom groups, they're Googling it, but they don't know how to access the right evidence based information that is going to help them feel really secure in protecting milk supply, protecting their mental health. And so IBCLCs are a fantastic resource to be able to help you reach your goals no matter what they are. And good IBCLCs will really take the time to listen to your needs, to figure out what your goals are, to even hear what it is you're not saying, and to help you be able to identify what you're afraid to say, because sometimes we have people who they're actually ready to start introducing some formula. Maybe all the pumping is stressing them out. Or maybe people are pressuring them to start formula, but they're not ready for that. And that's what a good IBCLC does, is we really help you to feel strong and secure in what your goals are and help you get there. And when you walk away from a visit with a good IBCLC, with a good lactation consultant, you feel like, oh man, I am not crazy. My experience is valid. It has felt difficult and it is difficult, but now I have some tools in my belt to try, and I have this person on my side who understands such a wide variety of topics, who understands the research, who sees the big picture, and is helping me tune into my baby and my body and my unique circumstance, and is going to help me get to my goals given where we are culturally and societally, so that I can have the most joy and the least anxiety feeding my baby as possible. So I hope that's been helpful. If you would like to work with an IBCLC, an internationally board certified lactation consultant, I knew from the moment I saw my first IBCLC almost 9 years ago that this was the work I was going to do. And I walked into her office, and in the middle of our first consult, I said, "How do I do this?" And she told me, and I thought, oh my gosh, that is going to be so hard. But I did it. I just started chipping away, and here I am. I've been a lactation counselor for 7 years now, but I finally can now say that I am an IBCLC. If you have heard me on this podcast and you've heard me fully listening to the people telling their stories and can tell that I am someone who will truly listen to you and understand your needs and understand where you want to go, and then will provide my expertise to help you get there or adjust as needed, then reach out to me at LO at quabbinbirthservices.com. I'll have it linked in the show notes, or you can go to my website, www.quabbinbirthservices.com. And if you know somebody who is wondering why they might need to see an IBCLC, and you think they might find this episode interesting, please share it with them. If you are looking for a community of people who know how difficult baby feeding is and are chatting about the barriers that exist and are hoping to uncover the answers to make it easier, join my Milk Making Minutes community group on Facebook, all linked in the show notes. See you there. Bye.